Hey, I'd like to welcome you to another episode of the Mission Matters Startup Garage, your source for all things startups. When my name is Adam Torres, you can follow me on Instagram at AskAdamTorres to keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Mario Anglada on the line, and he's founder and CEO over at Hoy Health. Mario, welcome to the show.
Thank you, Adam, for having me today.
All right, so I'm excited to get into what you're doing over at Hoy Health. Let's just start off with you telling us a little bit more about this medical ecosystem that you're building to really serve underserved communities across the U.S.
Absolutely, and thank you again for allowing me to participate in your podcast and to have access of our story to your listeners. So Hoy Health is built on a premise that we need as a company to be able to bring to the community solutions in the time of need. So when you look at the primary care landscape in America, there's about 36% of the population of the U.S. have and are designated as underserved medical communities. That means I either have zero insurance or I have high deductible insurance or lack of medical providers, et cetera. So a lot of folks, 118 million, have challenges in healthcare. When you look at primary care, which is 90% of your medical life, Adam, we're talking about a doctor consult that will lead me to a diagnosis. That diagnosis most likely leads me to a prescription, and that can be episodic. I have a throat infection and I get an antibiotic for it, or it could be chronic. I'm a hypertensive patient and I have this condition for the rest of my life. So at Hoy Health, what we decided to do was to go in and provide what is called our Hoy Health ecosystem. It's a three-part solution that is made for consumers directly, and the commonality of it is that it's built on the premise that it has to be affordable to anybody in the U.S. So I'll take you through the elements of the ecosystem. So number one, we provide telemedicine, right? Telemedicine is bilingual, English and Spanish. It's deployed via mobile apps or websites. So if you have a cell phone or you have a tablet or a computer, you can engage with our telemedicine providers. Those telemedicine providers today include members of the Hispanic National Medical Association, which that organization has over 50,000 healthcare doctors. Those doctors, we've identified over 100 of them who are interested in serving communities in underserved capacities. And we've launched a telemedicine solution that is going to be charging consumers $49 for a primary care consult. That means that if a consumer needs to have telemedicine offered to them, by being able to pay $49, they are able to have access to these doctors on a telemedicine consult via our platform. So that's the first element, telemedicine, and the program is called HoyDoc, and you can reach all our products through our website. The second element is once I get out of that consult with that physician and they decided that I needed a medication, many instances, if I don't have health insurance, the cost of medication is prohibitive. So what we did is we said, let's create a system where we can discount the pricing of medications to anybody in almost every pharmacy in the U.S. And we offer either free products or products that are very low cost. And I'll give you an example of both, all right? We have a discount card called HoyMed. It's completely free. When you use it at participating pharmacies, which are 65,000 in total, you get a discount of up to 85% from the cash pay rate. So if I paid $100 for a medication, with our product, it would cost you about $15. So significant discount. The second element was we figured out that a lot of families support each other at a distance. So example, my mother lives in Pennsylvania, I'm in New Jersey. We invented a model that you could buy medications for a third party. So let's say my mom needs her heartburn medication. All she has to do is call me. We will buy it on our website. That website will create a prepaid voucher, and that voucher will be emailed to my mother in Pennsylvania. By doing that, I paid for the medication. My mom received it in Pennsylvania. She prints the voucher and walks into any pharmacy in Pennsylvania with a voucher and a prescription, and I gifted medication to her. So there, the cost structure for that is between $10 and $40. So the highest price medication is $40. And lastly, let's say I'm a chronic condition sufferer. Like 85% of every senior has at least one chronic condition. Mm-hmm. So hypertension, let's start there. If I'm a hypertensive or a diabetic, I'm going to need consistent monitoring of my condition. I'm going to need to take measurements, a blood pressure cuff or a glucometer to get my blood pressure or my glucose level. Those, once I get them, I need to store that information and be able to transmit it to some healthcare professional, mostly a doctor in the U.S., and that doctor has to be able to analyze all that data. What we've done is we've created a system where that patient, when they come on our platform and buy our kits, and we call it a kit because it includes 30-day supplies of everything you need for your chronic condition management. So it'll include glucometers, lancets, lancing devices, test strips, solution, and it includes 2 30-day supplies of 1,100 different medications, all for a price of about $99 in the U.S. today. What we've done with that last product is we've closed the ecosystem around a primary care consult. So when you engage with OI Health, you're able to get a doctor, all your prescriptions, and your chronic condition management needs without the need for insurance. So the highest price point is $99 for a complete kit, telemedicine, $45. And when you're talking about medication, they can cost anywhere from $10 to $40 for 30-day supplies of medications that you would buy at the pharmacy at multiples of that price point. So that's our ecosystem, and that's how these are deployed to consumers.
Wow, that's absolutely amazing. And what I love about it is that it's something that, well, number one, you're obviously serving these communities that aren't currently being served and getting help. But number two, it's logical, it makes sense, it's easy to understand, so and it's affordable. So it's a great idea. So tell us a little bit more about the business. So how far along are you? Are you raising capital? Give us a little bit more on the function of it, please.
Absolutely. So the product is available in all 50 states today. So you go to our website, oihealth.com, and you're going to have an entry point into any of the products that we described. So the business has been taken off right now because of the COVID-19 emergency. Obviously, patients who need remote monitoring have started to reach out to us to have us deliver their medical supplies to their homes directly. We're doing and signing contracts with institutions like hospitals, clinics, and federally qualified health centers to help them manage their patients at home. And so the ecosystem is up and running in all 50 states. From a pharmacy perspective, we have a network of 65,000 in total. So every product and service that we offer can be engaging with those pharmacies if you need prescriptions. The telemedicine component we launched last week. We did it on purpose and accelerated the development of that in order to get help for those that are at home and don't have primary care solutions. So if you don't have a primary care provider, go to our website. At our website, you're going to have low-cost telemedicine delivered directly to you via mobile app into your house or via a video connection onto computer. So the ecosystem has been launched. We're scaling it. We're signing contracts with partners who help us deploy this. These partners include retailers, unions, trade groups, universities, as well as medical providers in the traditional sense, doctors, clinics, hospitals, and medical insurance plans. We are in the process of doing a capital raise, so we're closing our seed round, which is still available for investors. And that seed round at this point in time is for $3 million to help us deploy this and amplify our runway to execute against pending contracts with a wide variety of partners. And the idea is to continually offer more value to a consumer based on our understanding of if this works for the subpopulations that are underinsured. Now take it one step further, right? If it works for somebody who has very limited income and the product is one that they like and that they engage constantly with, why wouldn't this work for others who have better means, right? So this could be offered to eventually, and it's our goal to offer it to anybody in all 50 states and internationally as we started to expand our footprint in Mexico as we speak.
Man, this is exciting. I love it. So Mario, if somebody's listening to this and they want to learn more about OI Health, whether it's as an investor or a potential investor or as a patient, I mean, what's the best way for both to reach out?
So the easiest way to reach out to us is to send us an email or to go to our website. Our email is info, I-N-F-O, at OI, H-O-Y, health, H-E-L-T-H.com, or info at oihealth.com, or to go to our website, which is www.oihealth.com. And there you have contact information that you can reach out to our team, or send us an info at OI Health email, and we'll respond gladly to all inquiries via that method as well.
Fantastic. Well, Mario, really appreciate you coming on the show today and sharing more about all the great work you're doing, really working to serve those underserved communities, and ultimately after the model has grown and proven to serve all of us, underserved or otherwise. So I love your vision. I love the angle you're going at and the way you're scaling this. So great stuff there. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget, subscribe to the podcast, leave me a review on the Apple iTunes Store, and if you're watching this on our YouTube channel, Mission Matters Startup Garage, definitely give us a subscribe there, but also leave us some comments on the video. Love to know what kind of projects and what kind of things you're working on. And Mario, thanks again for coming on the show.
Adam, it's a pleasure. Thank you for letting me share our story with your audience. Thank you.